So good afternoon, everybody. On behalf of IACC, I'm inviting and welcoming all of you that you have taken time from your precious timing and busy schedule. So thank you so very much. Today's topic is about medical value travel. And we have all those star performer who has given a played a very big role in medical value travel. Because our honorable Prime Minister wants to make India as a most important place as a not only tourism but medical tourism also. So when everyone who is just looking for a good healthcare treatment, they are looking for India, because India is providing healthcare on a very different manner. I'm not talking about only rates or money. It's we have a different gesture to attend our patients. We always treat our patients as a guest. So we are giving them not only treatment, but we are giving them that kind of hospitality which is nowhere available in the world. So with these words, I would like to invite our Honorable Mr. Lav Agarwal ji, who is Additional Secretary, Ministry of Health and Family Welfare. We have with us Dr. Atul Mohan Kochhar ji, and Dr. Sanjeev Singh ji, and Dr. Mahajan ji. But first, I would like to introduce you. Everybody knows Lav sir, but it is my duty that I have to read his profile. So Mr. Lav Agarwal is an officer of Indian Administrative Services. He is a mechanical engineer from Indian Institute of Technology, New Delhi, after which he joined IAS and is allotted to the state cadre of Andhra Pradesh. He is presently on deputation to Government of India and is posted as Additional Secretary to Government Ministry of Health and Family Welfare, and has given responsibility of handling national and international operations, which includes digital health and telemedicine, National Center for Disease Control, COVID, climate change and health emergencies, antimicrobial resistance and rabies control program, zoonotic disease and disease surveillance for the country, besides being in charge for overall international health and cooperation on behalf of Ministry of Health. The COVID-19 outbreak has proven to be the biggest public health challenge of present time. Being Nodal Officer for Health Emergencies of India, he is responsible for providing supervisory guidance and has coordinated and proactive, preemptive and graded responsibility to COVID-19 outbreak as per evolving scenario. Previously, he has worked in various capacities since last 2 decades in his cadre, state of Andhra Pradesh. He served in various departments, which includes Health Election Commission, Power Distribution, Education, Youth Services and Sports, Housing and Disaster Management. Sir, you are very much involved with G20 and looking after all MVT programs as well as all healthcare programs which are taking place under G20. I would like to ask you, please guide us on how medical value travel can make change in India's in terms of we can say that image of India, as well as how we can earn foreign exchange with the help of medical tourism, and if we can club with tourism. Over to you, sir.
Thank you, Upasana ji, and let me also welcome my colleagues, Dr. Atul Kochhar, Dr. Sanjeev Singh, Dr. Mahajan, and other colleagues who have joined here in this web conference. And thanks a lot for inviting me over for this session. And I would just like to run through a small presentation just to take all of us towards the journey and where we think that medical value actually can be a game-changing event in terms of how India can contribute to health service delivery globally. I acknowledge that today, when we are meeting for the third Indo-US Service Summit, the focus of it is being that we accelerate Indo-US services sector. I believe that this is one area where if we can work collectively between two countries, this can be a game-changing event in terms of taking the agenda forward. Distinguished friends, you're all aware that under G20 India's presidency, the theme of India's G20 presidency is One Earth, One Family, One Future. And if I were to translate it into health sector, it would translate into one earth and one health. I'm sure you would all agree that pandemic has taught us that no one is safe till everyone is safe, and when it comes to health, we are all connected. Within that framework, as directed by Honorable Prime Minister, the overall vision which Ministry of Health, under the guidance of Honorable Minister of Health, is how do we create a mechanism where international patients do not suffer because they may not have one particular treatment or a quality of treatment not available in a particular geography. Or similarly, how health workforce from one territory can actually go to another part of the world and help upgrading the services there. So we're talking about two approaches here. One of patient and second is about health workforce mobility. And this is in these two paradigms, we believe that India, in collaboration with other countries, can actually make a game-changing impact. Just to highlight, we believe that if we have to genuinely achieve universal health coverage, both of these components have a very important role to play. And when it comes to India, patient mobility, we would like to highlight that it will help us getting right access of quality and affordable treatment in the standard healthcare facility. It will also ensure that the patient treatment do not get delayed. And when it comes to India specifically, I would like to highlight whole world is today talking about integration and wellness as an approach. So how do you create holistic healthcare? This is another area we need to work together. And also there are certain processes, medical procedures which may not be available in certain geographies, how those can be made available. Similarly, when it comes to health workforce mobility, we are all aware that it is important to have trained and qualified medical practitioners not only in limited territory but across the globe. We all discuss about rural divide, but we should also be aware that there divide between geographies also, between countries also. And how do we create a paradigm that the capacity building of health workforce can take place? Creating a mechanism where knowledge transfer, sharing of expertise, and with that we can collectively work. If we can focus on these two aspects, we believe that the genuine attainment of universal health coverage may be feasible. If I were to highlight, talking about medical tourism, we need to think medical tourism in its holistic manner. It is not only about modern medical treatment for curative purposes, but it is also about traditional medicine, which talks about wellness and rejuvenation focused on spiritual and well-being. So unless until we think of medical tourism in its wholesome approach to that extent, we will actually not be able to take the best advantage of what different therapies and approaches has to offer to the globe today. I would like to specifically submit that there are very specific economic imperatives from a service sector point of view in terms of medical travel. Just to highlight, if we see the global market size, in 2020 it was expected to be around $41 billion. And in 2026 it is supposed to go to somewhere around $192 billion. So approximately around 5 times increase is expected in a period of 6 years. One sector which is growing at a cumulative aggregate growth rate of 29.3%. In terms of India's advantages, I need not highlight, but just to again sort of reiterate, we're all aware that whether it comes to allopathic doctors, we have 1.3 million quality trained allopathic doctors, 800,000 doctors from traditional medicine, and 3.4 million nurses and ANMs across the country. Most of them can speak in English. We also have focus on traditional medicine. And when it comes to, I submitted about the fact that there are territories where if you have to get a specific procedure, there are delays in terms of 6 months to 10 months. And for that particular time, if a patient cannot wait, it is at these times, these fast track appointments which can be made available in India can be a boon to that patient. Equally, the focus on value for money approach. So the treatment, the quality treatment in India is available at 1/3 of the prices at what it may be available in other parts of the world. And we have large number of standard hospitals, more than 44 JCI accredited hospital and 1,600 plus NEBH accredited hospitals. And I'm sure you're all aware that we provide the required state-of-art infrastructure. I would also like to highlight various studies have also put across to us that in terms of medical tourism index, India is already 10th in the globe and it is rising. If we look in terms of specifically in terms of traditional medicine, be it Ayurveda, be it yoga, naturopathy, Unani, Siddha. Across the spectrum of traditional medicine, India has large number of Ayush related workforce, and this is another sector where we can provide services across the globe. And if we were to sort of highlight further, I just would like to show you a small snapshot of what media has already covered multiple times. Queen Camilla visiting India for holistic therapy. Similarly, a patient flew down from US to Chennai for medical treatment. And like a child came from Pakistan for bone marrow transplant. Distinguished friends, I would just like to highlight that India's success can also be gauged from the fact that 8% of world's kidneys transplant and 5% of world's liver transplant happen in India. 12% of total open heart surgeries happen in India. More than 50 country patients visit to India, and more than hundreds of thousands of patients who actually have taken medical visa, and more than that number come for wellness across the country for treatment. To facilitate this process, I'm sure few colleagues are aware, but to appeal to other colleagues who are present here, we realized that technology can actually support and ensure that this process can become much more transparent and seamless. And we did a process analysis of the end-to-end patient journey, and we want to convert that process into a digital process where across the spectrum there will be available dashboards and you can manage the patient journey across for medical value travel, whether it is identifying treatment options which may be available in India, getting in touch with the medical facilitators, sharing your records with the doctors and the hospital concerned, finalizing your medical visa, coming to India, getting treated, and post-operative care. The whole spectrum can be managed through the whole process by this digital platform. This digital platform will have search functionality, will have patient journey tracking. It is supported by a mobile application, and when it comes to multiple country patient visiting India, there is an integration with WhatsApp. There is a facility to do teleconsult in advance. And equally important, it ensures transparent pricing and a grievance redressal mechanism. Today, I'm sure you would be aware that at times some complaints do arrive that I was cheated by some unscrupulous element, and one event, while hundreds and thousands of patients are getting good treatment, but one event like that can actually give a bad name to the sector. And it is at that point of time the grievance redressal mechanism will ensure quality of medical value travel, the understanding of that patient within this country. Distinguished friends, we have been working towards, as Upasana ji has rightly mentioned, we have been working towards interacting with governments across the globe in terms of how we can create a overall ecosystem where between countries this relationship can be strengthened. Be it the visit to Kenya and Tanzania, be it interaction with the Deputy Prime Minister of Uzbekistan and other joint health working group meetings with multiple countries, we have realized that the collaboration between countries in the field of medical value travel has always come out a very positive frame of reference. I would also like to highlight that we have been interacting with Indian missions abroad. In last few months, we have interacted with our Indian missions from 61 countries. We have identified certain countries where we are creating a specific action plan to promote medical value travel. And we would be even thinking in terms of providing nodal officers to certain Indian missions in identified countries where the whole process can then be taken down to the masses. I would highlight that when we talk from services point of view, under the overarching framework of One Earth, One Health, we believe that there should be a paradigm where equitable access, affordable and quality healthcare with without the required financial hardship should be made available to patients across the globe. We also would like to look for collaborations between governments, collaboration between industry players, that is one hospital of a country collaborating with another hospital of another country, or preferably the US, trying to work out this collaboration among themselves, collaboration between insurance company of one country to either the insurance company or hospital or medical value travel facilitator in another country. And we would like to create a collective approach where world-class healthcare and wellness services can be made available to everyone. In the end, I would like to request that as a collective efforts, we can align with our colleagues from US and with our hospitals, both Ayush as well as the modern medicine, and we can work towards creating creating line where we can promote value-based healthcare across the globe. Thanks a lot, and I would be really looking forward for interventions for other colleagues in terms of how to take this agenda forward collectively. Thank you very much.
Thanks a lot, Mr. Lav Agarwal ji. Your words of wisdom was really very powerful message to all who are not aware about what is medical value travel. They must have listened and understand. Before you leave, I would like to introduce you to our National President, Dr. Lalit Bhasin ji. He is very well-known figure in legal sector, and he is our National President. Sir, all these people who are here, they are gem of healthcare. I have selected the best people from healthcare. And I would like to tell you, sir, when I was in Berlin, so I was just talking to residents of Berlin that how you are getting your treatment. So they said that it's a very long queue. We need to take appointment if there is a regular OPD. At least we need to wait for 6 months. So then they asked me, ki, why don't you start something like we want to come to India for medical our treatment. Sir, we can start something from there. We had a word with ambassador also. I was there, so he was also saying ki, things are very good, but only one thing is there that they need to wait for long. So, sir, there are many countries where we can start our this big. I want to say that it is a basically vision of our Prime Minister that he wants to invite every country to India for health treatment. So thanks a lot, love sir, and hopefully this G20 you are going to win all those things which we were just lacking behind. So thanks a lot for coming and giving us your word of wisdom. Thanks a lot.
Thank you, Upasana and all other colleagues, and Dr. Lalit ji also. Thank you.
Thank you. Now, I would like to invite our next speaker, Dr. Atul Mohan Kochhar ji. Dr. Atul Mohan Kochhar obtained his MBBS and MD from the prestigious Delhi University. He was awarded the University Gold Medal for excellence in the field of dermatology, mineralogy, and leprology. He is also a diplomat of National Board, DNB, Dermatology and Mineralogy, a member of the National Academy of Medical Science. More than 70 publications, 4 books, and many chapters and multimedia to his credit. An active practicing clinician with a passion for quality in healthcare, a principal assessor with NABS since 2016. He has since December 2019 taken over as the Chief Executive Officer of the National Accreditation Board for Hospitals and Healthcare Providers of India. Quality promotion of patient safety and taking best healthcare practices to the poorest of the poor are his mission in life. So this is not only this small introduction cannot tell about Dr. Kochhar because I know him personally. So I understand his passion for quality. And if we talk about MVT, he has already accredited those who are running medical value travel companies. So with these words, I would like to invite you, Dr. Kochhar, please tell us how NABH is helping India for medical value travel. Over to you.
Thank you so much, Upasana madam. Respected Dr. Bhasin sir, Dr. Lav Agarwal sir, Dr. Sanjeev, and my friends. I'm immensely grateful that I've been given this opportunity to be a small part of the IUCC, the third edition. And with your permission, is my screen visible to all, ma'am?
Yes.
So I'll quickly take you through as Dr. Lav Agarwal sir has rightly said the context and how India is emerging as a real brand. Brand India is emerging under the guidance of our honorable visionary Prime Minister, and how Ministry of Health, especially Lav Agarwal ji, is carrying forward that agenda in a very systematic, quality-oriented manner. So we are all aware that India is a big country. In fact, it's a federal structure with 28 states and 8 union territories. But these are comparable to about 36 countries rolled into one. But what unites us is a culture of transparency, honesty, timely communication, and respect. So these things are ingrained in our ethos. So we take pride that we welcome our guests truly, which is imbibed in the statement Atithi Devo Bhava. And we also consider the entire world, as our PM has guided us, as a Vasudevai Kutumbakam. So basically, for us, one earth, one world, one health is not just a slogan, it's a way of life. So that is what we wish to implement. And we also realize that uh, that quality healthcare, there are basic tenets. So in spirit, we are trying to implement the universal health coverage, and truly we want healthcare which is not only safe, not only timely, but it should also be efficient, effective, equitable, and very patient centered. And binding it all together is the essence of quality. So quality is the framework around which the entire UHC algorithm is being built upon. And India is today very proud to project as one of the one of the 40 countries which have their own healthcare standards. So I think there are only about 40 countries, and these are the accreditation standards of healthcare providers, and they truly help to ensure that they meet quality standard and provide safe, effective care, covering all those basic tenets of with there. So this is the logo which signifies that a hospital is NABH accredited. As Lav Agarwal sir very rightly pointed out, that today there are 1600 plus accredited facilities in the country, and a whole lot more certified facilities which have already started their journey towards quality, and soon they may also be accredited in real time. So this mark of excellence, I just want to briefly inform you that what goes on behind the scenes when you see this logo, what you can expect. So behind this logo is the journey of Quality Council of India. And Quality Council of India is an independent autonomous organization under the DPIIT, Department for Promotion of Industry and Internal Trade, nested under the Ministry of Commerce and Industry, Government of India. It was set up in 1997 by Government of India, coming together in a unique public-people partnership initiative, along with the main industry bodies like ASSOCHAM, CII, and FICCI. And the chairman of Quality Council of India is directly appointed by our Honorable Prime Minister. And many great leaders have today nurtured Quality Council of India, starting from Sri Ratan Tata ji, then Mr. Venu Srinivasan, Dr. Mashelkar, Mr. Amitabh Kant, the G20 Sherpa, Mr. Adil Zainul Bhai, and leading on to Mr. Jakshay Shah, who is today the current leader at QCI. So they all come with a rich vision and to improve health of the country at the grassroots level, and also with a spirit to share this goodness with the world actually today. So all we are very fortunate that Quality Council of India has various boards, and each of these boards is headed by very eminent, very decorated, all grassrooted people who work for a unison in the quality standards in every domain of the ecosystem. We work very closely today with all major ministries, all major departments, starting from coal to fisheries to hygiene to Swachh Sarvekshan. We own various marks such as the Ayush mark. We also work with as diverse spectrum as the drone policy, the geotagging, the traditional medicine. So all these things are a small part of the basket of Quality Council of India. We enjoy multilateral mutual recognition arrangements, the MRAs, with various international conglomerates and bodies, which are the umbrella bodies. So India today occupies a place of pride in ISQA and ASQA, which are the leading healthcare accreditation bodies under which all the accreditation boards nest. So NABH is one of the constituent boards of Quality Council of India. It was formed in 2005. We released our first standard in 2006, and every 3 years since then, we have been upgrading the standard, raising the bar a little, and raising the healthcare quality. So over the past 18 years, we have built a very strong foundation of uh, quality in healthcare based on all the basic tenets of patient safety, healthcare quality, all measures in place. And today, NABH is playing a pivotal role at national level, not only national level, also at an international level, because we have an international small wing where we are helping our colleagues in other parts of the globe, in 8 countries, as far as Philippines, as all the SAARC countries, Uzbekistan, Oman, Muscat, etc., which countries which do not currently have their own standard, they rely on our standards. So that is also there. But one thing which is extremely common to our NABH Foundation, which we echo in our national pride also, is credibility, responsiveness, transparency, innovation, and ethics. So essentially, these are the values on which the strong foundation of healthcare quality accreditation, the NABH, is based today. We enjoy global recognition, as I mentioned, by ISQA and ASQA. We are one of the founding members and the permanent board members, the national members of ASQA, and we also occupy a place of pride in the 43 country strong ISQA. Uh, we our entire organization uh, is ISQA accredited, and not only the organization but our main healthcare standard also is since long is today ISQA accredited. All our standards we want to dissipate. They are available free of charge, and they are truly the sterling example of self-reliant Atmanirbhar Bharat today, which is working towards the vision of one Earth, one world, one health. We today touch about 18,000 hospitals under our various programs. But like I mentioned, that across all these programs, there is a strong value system. And we also take pride, as Lav Agarwal sir mentioned, that our traditional system of Ayush and spiritual wellness, they all find a place in our Ayush accreditation standards, which bring the touch of modernity, the evidence-based medicine, all those things, the patient-centered medicine, the precision medicine, uh, and all that quality has been brought into this traditional realm. And today we accredit about 246 Ayush facilities and more than 2,000 entry-level setups, which are there in 4 nooks and corners of the big and diverse country. We realize that medical value travel today is a necessity. As Upasana madam mentioned, as Lav Agarwal sir mentioned, that there's a large waiting time in various developed parts of the world, and patients there cannot wait for that long. So India is a very viable option because here we ensure quality, we monitor quality, we adopt quality, and we implement quality. So this is a very strong bet if you see this logo. And NABH MVTF empanelment program runs on not only the organizations but also on a backbone of very strong facilitator. So medical value travel facilitator program under NABH was launched in 2016, and this ensures that there are special kind of facilities which are truly in connect with the empathy, with treat every patient as a family member, and they ensure end-to-end facilitation of these patients. So adopting and implementing standard and guidelines for medical value travel is a necessity today to cater to all the grievances, concerns, and give appropriate guidance to the patients who come from far and seek treatment elsewhere. So our ultimate beneficiary of the entire protocol is the patient, of course, but not only the patient, there are immense benefits for the organization also, which adopt these MVTF guidelines. So these 1600 plus facilities, out of that about 100 organizations, standalone organizations today, are accredited and empaneled by the Medical Value Travel Facilitator Program. So today we occupy a place of pride in the portal, which has been developed under the active guidance of Lav Agarwal sir, the healinindia.org, which is still taking shape. But the impact of NABH MVTF empanelment will be felt far and wide. So medical tourism, as we all realize, it requires a very strong presence of accreditation of healthcare. So this logo, please look up to that. And there's a lot which goes behind the activity, and we continue to stand by our values and improve upon them. All our portals are technology intensive. They are truly transparent, objective, and anyone can trace and see and check And we are soon going to release the outcome-based monitoring parameters also. We work very closely with National Health Authority, the Ayushman Bharat Digital Mission. So all the interoperable, the blockchain effectiveness, the validation protocols, the data privacy of the patients, all those are key cornerstones of NABH standards also. So with those small words, there's lots to be learned from our portal, our website, www.nabh.co. So I'll encourage and suggest, so we keenly look forward to your further suggestion. Thank you so much, Jai.
Thank you so much, Dr. Kochhar. It was wonderful listening you, but because I work closely with the NABH, so it was actually, I was feeling very proud that we are doing such a great job. So with these words, now I would like to switch to our next speaker, Dr. Sanjeev Singh. Dr. Sanjeev is a pediatrician by training and did his master's in hospital management, PhD in infectious diseases. He was working with WHO in disease eradication program before joining Amrita. He has served as Chief of Medical Services at Kochi campus for 18 years and has joined as MD at Faridabad campus. He is technical advisor to Government of Kerala on infection prevention and antimicrobial stewardship. He is co-chair at FICCI Health Service Committee, member of National Task Force of Antibiotic Stewardship, Technical Committee of at NABH, Accreditation Committee at Health Sector Council, Drug Safety Council, and Occupational Exposure Committee. Dr. Sanjeev, you have done a very, very big role in different field of healthcare, but I must congratulate you for your antibiotic and antimicrobial program. I would like to know from you that how these kind of good work can impact on our medical value travel. And now I would call you Smile Man of India. So please would like to listen from you because your smile is really very shining. Over to you.
Sure. Thank you so much, Madam. It's always great participating in your programs, and I label you as one of those healthcare leaders who have done such remarkable difference. And thank you, Dr. Kochhar. It was, as Dr. Upasana said, it was always a pleasure listening to you, and it makes us all proud that so much of work which happens under your leadership at NABH, and we very strongly feel part of it. And then thank you for doing such fantastic work for the country. Thank you, Lav Agarwal ji and Harsh Mahajan ji and Lalit Bhasin ji. Dr. Upasana did ask that question, that how the institutes will make a difference. There are many things which are happening. We run a 2,600 bed capacity university teaching hospital, which has a medical school, nursing, allied health sciences school. And fortunately, we see a lot of attraction for international medical value travel patients. What helps us is that there is a very amenable legal framework which has already been established. There is definitely a cost advantage for all these medical value travels who comes here. If there is a bypass surgery which is done at many areas at $1,30,000, it would be possible in India within $7,000, $8,000. The valve replacements, the arthroplasties, the spine surgeries, which is, though Lav Agarwal did mention about 1/3, but many of the services are is available at 1/5 and 1/10 of the cost. There is this quality journey, which is definitely very palpable, and Dr. Atul Kochhar did allude to that. The hospitality makes it very, very easy. And I think that is where Amrita also makes a difference, where love and compassion is our is the basic DNA. And we work on a tagline of embracing good health. So lifestyle modification and prevention is something which is beyond just the healthcare which is being provided. We run an institution which is in Kerala, and beyond allopathy is I think one major area for medical value travel. And we have seen that attraction because human medicine has its own limitation, but then alternate system of medicine has done such fantastic work. It has run wonders with respect to non-communicable diseases. and they have treated patients with chronic liver failures and chronic kidney diseases. There has been very good models which have been also in now daycare models, healthcare independent models which are coming up, which has done well. So overall, I think it is a very exciting journey, though there are some challenges of not having a single window approach and infrastructures and connectivity, which is a problem, especially when we are there in Kochi. The direct flight would be was always an issue, but then there is a lot of good work which has already been done. So Dr. Upasana did mention about how we could make a difference. So there are in our area, in our country, we have a lot of good talented workforce. So our doctors are extremely outstanding. They have the competency, they have the skill sets, and that is where the clinical excellence program are par excellence. So all the care pathways which have been set up, all the important clinical path guidelines which have been set up. So the work which has been done matches the international standards. And that is where it becomes extremely important that we benchmark. We are benchmarking with some of the best Ivy Leagues of the which are available globally. So there are clinical indicators which are getting captured. There are clinical audit programs which are there, and these all programs get benchmarked. There are service excellence which are equally extremely beneficial. There are process efficiencies which are happening. There are people, the hospitals which are working on operational efficiencies, all the pain points which were there for any medical value travel to take a judgment regarding being India or any of the institutions being a preferred destination is also being diminishing, and that line is getting fader because admissions, discharge, transfers, and most of the process is far beyond accreditation. The inventory management, the safety, the patient safety, the healthcare worker safety, and facility safety is something which has been of concern, and there is remarkable work which has already been done. Every work which has been done by every institutions which are accredited, they have the key performing indicators which are regularly collected, which are verified, which are validated, and it is measured against internal quality checks and external quality assurances. Patient is being the center of all the work which has been done. So there is a patient for patient safety movement, which is where they participate, they're part of the governing council, and they make a huge difference. Plus, then there are lots of best practices. So in every center of excellences which have been developed, so whether it is renal sciences, cardiac sciences, neurosciences, gastro, the work which has been done is just phenomenal. So it is a super specialty. It is something which is cutting edge. So there is a lot of technology-driven innovations. There are a lot of competency and skills-driven innovations, which brings in good practices. Like this is a third Indo-US Summit. We recognize that there is a fantastic program which is called as Hospitalist Program in US. There are lots of hospitalists who have come back to India, and they have also brought in this particular culture of taking care of the patients and quality improvement programs. And they so there is a lot of learning which can happen between Indo-US ties to bring in good technology, bring in good service excellence program, and bring in good clinical excellence program which is there. But so these opportunities, definitely, with so many 1.3 million doctors, with so many 3.4 million nurses, our continuous education program is going to be extremely helpful. The talent pool is very, very good. Political will has been demonstrated with Lav Agarwal ji being present. States have to really take up more responsibility. Like Kerala organizes their own healthcare tourism program every year along with the industries, and they have done phenomenal work. So there are these collaborations which works very well, and I'm sure with programs like this which Upasana ji has organized, and with the key leaders with being present, it will have a major impact. So over to you, Upasana ji. Thank you so much for giving me the opportunity.
Thank you so much, Dr. Sanjeev, because I think most important pillar of medical value travel is quality. So I am happy that our government has decided to make this portal with only NABH accredited hospital, which is a very good initiative taken by government. So Now such kind of problems which a few years back people were facing, that they were coming to any hospital, they were not a good doctors were there, not they were actually qualified persons. So now that kind of problem will never occur, and our name and fame, everything will go worldwide that India is the best place. Thanks for that. Now I would come to our next speaker, Dr. Harsh Mahajan. Dr. Harsh Mahajan is an eminent radiologist and pioneer in the field of MRI in India. Having set up one of the India's first MRI in 1991, he is the founder and chairman of Mahajan Imaging and Labs, which runs a chain of diagnostic centers in North India. He is also the chairman of CARING, the Center for Advanced Research in Imaging, Neuroscience and Genomics, and the Department of Nuclear Medicine and PET-CT at Sir Gangaram Hospital. He has been a consultant to the International Atomic Energy Agency, Vienna, Austria, advisor to UPSC, and is currently a member on the board of NABH and the Health and Mental Health Committee of National Human Rights Commission. He is an advisor on several government committee and national steering groups, including those for making an indigenous MRI, for making a thermomammography bra, for screening for breast cancer, making indigenous transducers for ultrasound machines, and several others. He has lectured around the world and is a postgraduate teacher and examiner with keen interest in research, especially in the field of artificial intelligence. Graduate of MAMC New Delhi, postgraduate from PGI Chandigarh. He did a fellowship in MRI from MD Anderson Cancer Center, Houston, Texas in 1987 to 88. He was awarded Padma Shri by the Government of India in 2002 and has been National President of Indian Radiological and Imaging Association in 2012. Indian Society of Neuroradiology in 2005, President of Nat Health in 2001, Chairman of Diagnostic and Hospital Committee of PhD Chamber of Commerce in 2022, and is the current Chairman of the Health Service Committee of FICCI. He is an active social worker in the chairman of NGO Tamanna, which runs multiple school of the Multiply Challenged. He is a trustee of Rotary Gift of the Life Trust, which provides free cardiac surgery to children, and is a member of Delhi Public School Trust Society and vice president of DAV College Managing Committee. He has been on the board of Sri Ram College of Commerce and Punjab National and Indian Overseas Bank. Dr. Harsh, we always talk about healthcare and doctors and physicians, but now I want to know from you, because you are a well-known radiologist in India. Everybody is looking for some new thing at Mahajan Imaging Center. Sir, how can we do, like radiology can create an impact on medical value travel? Because when patient is coming and getting his surgery done or something, they want to get some follow-up things. So that how not only consultation, how radiology can create a big impact on medical value travel. Over to you.
Thank you very much, Dr. Upasana, for inviting me. Dr. Lalit Bhasin is here and other eminent panelists. It's wonderful to be here and hear the views about medical value travel, where India is currently and where we aspire to be. Because ultimately we are all in this field for healing of the patient, irrespective of national or geographical boundaries. And when we talk of diagnostics, I think radiology is one part of the whole diagnostic armamentarium. And so currently the new buzzword doing the rounds is integrated diagnostics, because, you know, by and large, we still tend to work in silos: radiology, nuclear medicine, lab medicine, histopathology, genomics, and so many other fields. So I think what India can provide is a holistic approach, not only to wellness and therapy, treatment, but also to diagnostics. And generally, right now, how it gets used in medical value travel, of course, it gets used when a patient comes to a hospital, gets admitted for some treatment. Radiology and lab medicine and diagnostics are a very important part. But we also see that patients' relatives who are accompanying, they tend to come for diagnostics, preventive health checks. They come for CT coronary angiography. They come for, other routine diagnostics as a preventive part. They may not have any problem. This, I think, is one aspect we need to leverage. And here I must say that the wellness part, which I think going forward with Ayush, with yoga, with the various, spa treatments, which are different from the routine rut of the mill that is available in other parts of the world, I think diagnostics can be embedded along with these wellness, within these wellness retreats, so that we are able to find out what are the other issues that a person who comes for a wellness therapy suffers from, and then even after they undergo the therapy, to see what is the change in some of the parameters which can be measured. So this I see going forward as a big contribution from the diagnostics field to the wellness and medical value travel. The other area is teleradiology, something which has been on. In fact, there are teleradiology companies in India which are providing services to even the best of hospitals in the US. This is a partnership which has been on for nearly 2 decades, and where there is shortage of radiologists, especially during night time in the US hospitals, that is when the scans are sent seamlessly. It takes a few seconds for the scan to be transferred here, and within half an hour for X-ray and CT scans to 2 hours for MRI, the reports are sent back by US trained and US accredited radiologists who are functioning in India. This is also an area where we can work together.
Thank you, Kashish.
Where in underserved parts of the world, in parts of Asia, parts of Africa, where there is a shortage of radiologists,
Hello.
we can work together.
Thank you, madam.
Someone
Services.
has, sorry, just
1 minute. Can you see me? Just
speaker is on. Kindly only who is speaking. Otherwise, I think
Mr.
somebody's
Bora, I
speaker
think.
is on. Kindly switch off. Speaker, you have to. Yeah, sir, please carry on.
It's been done. So this is one area where we can work together. Teleradiology is something which has been there for 2 decades, and this can be taken forward. We have a large chunk of talent in this country which are US accredited. We have a large chunk who are UK accredited. And here I think, Upasana ji, I would request the chamber to actually look at reciprocal recognition of degrees, something which can be done through, even if it is those who are working in NABH accredited hospitals, their degrees, if there is some reciprocal recognition that can be done, we can actually help in shortage of radiologists in the US, especially for very high-end investigations like MRI, CT, and PET CT. The other area is of course, lab medicine, of genomics, where again, we have very high quality labs which are there in the country. We can get the samples easily sent from across the globe, and we can help at lowering costs for these tests as volumes would become high. So that is something which is even today being done. But this is one aspect, the medical value travel agencies can look at and build into the facilities that we provide to different parts of the world. The other area, I think, is of South-South cooperation, where medical value travel in the countries of the South, where the facilities are inadequate. I think through our embassies, which Mr. Lav Agarwal alluded to, he even talked of having nodal officers within embassies, because currently actually medical value travel is quite disjointed. It is not coming on a country to country level, on an external affairs ministry or an embassy to embassy level. I think this is an area where we can focus so that patients who come from abroad are not misled. They are led to institutions of excellence, which are all NABH accredited, which have great, doctors, great facilities, where I think accreditation can be very, very useful. So in conclusion, I'd like to say, even though diagnostics forms a small piece of the medical value travel as it exists today, but there is an opportunity that is available based on the kind of technology that we have in our country, which is second to none. The best medical equipments, the best personnel manning them, that we become a much more important piece of medical value travel, both in wellness as well as in the therapeutic field. Thank you very much for giving me this opportunity.
Thanks a lot, Dr. Harsh. It was wonderful to listen to you, and in a different point of view, like we are all the time talking only about how we will do patient safety, how we'll look after, but there are many things which are we can do. So with these words, I think we should focus more on medical value travel, because now India is the world's most populated country. So when we can, train more doctors, more nurses, and not only in India, we can provide our nurses and doctors to other countries also. That is why this service sector is coming into the picture. So we can, we can be world leader in terms of healthcare system, and we can provide our services to all those nations who are actually suffering from lack of manpower. If you go to other countries, you will find, because of their, they don't have much manpower. They are depending on machines, and lots of computerization is there, but there are few things which no computer can do. That is our nursing care and our, which doctors are doing. Lots of, artificial intelligence is coming in a very big way, and I really appreciate that. But there are something which only a consultant can decide what is the problem, how he has to going to treat this patient. So there are many ways India is actually go ahead, as you were talking, Dr. Harsh, that we have the best machines, everything. So I was in different hospitals in different countries. I have just for my knowledge, I was visiting. So I can see all those machines which we are using, name G, name Siemens, name any other company. Same machines we are using, same machines different Harvard Medical School is using. So, and our doctors, Indian doctors, are running healthcare in everywhere, in either if you talk about US or Europe, everywhere, our doctors and nurses are actually looking after the patient care. So I think it's a very welcome step from our government. So we need to focus more on this, and with the help of government, I think things are changing. Lots of more medical colleges into the picture now, and even our Honorable Minister Mansukh Mandviya ji visited my hospital for robotic inauguration. Then he asked me why you are not opening medical college. So it's an inspiration, and like Dr. Sanjeev Singh, who is already running big medical college in Kochi and now in Faridabad. So if government is taking interest in medical education, though no one can stop us, because Hindustanis are actually very hard working. And I can say with these words that our partners, who is our chamber partners, US, we can create a different kind of setup everywhere, not only in India, even in US also.
Am I audible, ma'am?
Ma'am, sorry to interrupt. I'm so sorry. The Honorable Minister's office wants to check the audio.
Yeah,
I'm so
please.
sorry to interrupt in between.
Is it audible, ma'am?
Yes.
Yes, sir. You are. Yes, sir.
Can you see my camera as well?
I can. Yes.
Okay, ma'am. Thank you so much.
Thank
Minister
you
sir will
so
join
much.
shortly this meeting.
Yes, please. Thank you.
Yes. So, Lalit sir, would you like to say some concluding remarks, sir, please? Sir, you are on mute.
Yeah, it has been a great learning experience for me. My field is the field of law, but somehow field of law and healthcare are now together, particularly in the field of matters of medical negligence and the cases which come up very frequently. That is where our two professions have to get together and play an important role and significant role. And I think this was a brilliant initiative by Dr. Upasana Arora, not only to have this particular event as a whole, but to focus on healthcare with such eminent, distinguished specialists from their respective fields, such eminent doctors. So I convey my grateful thanks to Dr. Upasana Arora and to all the worthy panelists who are here today for their excellent contributions. As I said, it was a great learning experience for me. Thank you very much.
Thank you, sir. Thanks for your word of wisdom. You are the one. We are always looking at you for many things, as you are my mentor also. Because of you, I am here. So, sir, I think now our next session is a special session with our Honorable Minister. So, but I would like to convey my thanks to all of you who has joined us for this important session. And it is really important because government is taking so much interest. And I think in my next meeting, which I am planning to meet our US economic persons for doing something in medical field with US. So your points I have taken care, and I am going to discuss all these things with them also. With these words, I think this session we need to close. But now we are waiting for our Honorable Minister, sir. So then we will talk about differently how service sector can do better with this chamber. So because it's a bilateral chamber, so we need to work together and create a different kind of, because every year there are something happening new between these two countries. So this is high time when we have a very good relation with our USA President and our Prime Minister. So it's a good time that when as a business perspective, we can do many things. So I think it was a good session, and all those who are listening to us or who was just participating, for them, thanks a lot, because when we are talking and we are doing any webinar, it is very important, and where this message is going. Not only we are listening to each other, it is important that others are also joining, listening, and then this message can spread it to the masses and others also. Thanks a lot. Kashish, how much time?
Ma'am, so we'll go live in 1 minute. So we'll start at 4 o'clock. Honorable Minister will join in between.
Okay, so I will start with welcome note, and then I will invite Bhasin sir, then Bhasin sir.
Right, ma'am, right.
Hello, Pankaj sir, how are you?
Pankaj ji, welcome.
I'm sorry, I was on mute. Good afternoon, sir.
Good afternoon.
Good afternoon, madam. Good afternoon, Kashish. Good afternoon, Jyoti ji.
Good afternoon, sir.
Good afternoon, all the participants who are not visible to me.
Sir.
But